This is an interim video based on the evolving story around puberty blockers and the Tavistock Centre. There's an article in the Telegraph about more private clinics setting up and what that could mean. We've had some slightly positive news in relation to the Tavistock and the CAS report, although it doesn't go anywhere near as far as it needs to do. Really, we need a public health inquiry, and we need to ban all puberty blockers and interventions of children, because there's literally no systemic evidence whatsoever in over the 100 years of interventions that have been carried out to assert that there is any benefit to children going through any social or medical transition. This story is in the Telegraph, and it is about some former staff that worked at the controversial Tavistock facility as setting up a private gender clinic, which is extremely worrying. So I'm just going to go through the story with you and introduce you to the people who are setting up the new centre. So it says, former staff from the controversial Tavistock Gender Clinic have set up a private service for children and teenagers, offering referrals for hormones and surgery. The private clinic has opened since NHS England announced it would be closing the Tavistock amid safety fears, while also cracking down on the use of puberty blockers. Gender Plus offers specialist gender assessment for children, adolescent and young adults, which can be used as onward referral to an appropriate endocrine or surgical team. Now, we know from the interim CAS review that that means if children decide to go to this Gender Plus first, then the NHS will just pick up where they've left off. It is not preventing children from being put on puberty blockers or being put on this pathway where they can't seem to get off the conveyor belt. It is also setting up an associated hormone clinic, which will be run by Paul Carruthers, who has been a key member of the same team in the NHS since 2015. So Paul Carruthers is a nurse, and he's worked at Leeds LGBTQ plus clinic. I'm going to put an image of him so you can see with some information. Around half of the staff members listed at the new Gender Plus clinic have worked with the Tavistock, including the clinical director, Dr. Aidan Kelly, who was at the NHS's only gender clinic for children for 5 years. Dr. Kelly is described by Gender Plus as having specialist skills in the assessment of gender identity, which doesn't exist. Gender identity, needs, and making recommendations for gender-affirming medical treatments. And it is said that he is passionate about increasing access to care for gender-questioning people. Details of the clinic have emerged just days after the NHS England confirmed that it will only prescribe puberty blockers to children as part of clinical trials, as there is not enough evidence to support their safety or clinical effectiveness. Concerns have been raised that private clinics may be able to bypass these new protections. The crackdown came after an independent review led by Dr. Hilary Cass. It warned that there was not enough research on the long-term impact of hormones on young people, and that they could damage brain function. In fact, there are studies to suggest it does damage brain functioning. The interim report also raised fears that doctors were under pressure to adopt an unquestioning affirmative approach to gender identity, at odds with the process of clinical assessment, because it ignores other medical or mental health problems a child may have. And as we've seen from the Time to Think book from Hannah Barnes, a large percentage of the children who were referred to GIDS had autism, were homosexual, or were going to grow up to be, or at least 5 comorbidities, such as the death of a parent or loved one, trauma, being part of the care system, so many other factors to consider. The review followed almost 2 decades of concerns about the Tavistock, including from staff who blew the whistle on children being rushed into medicalisation. 7 of the staff members listed on Gender Plus's website used to work for the NHS's Gender Identity Development Service, or GIDS, run by the Tavistock, or one of several satellite clinics. This includes Dr. Kelly, who served for 5 years and was responsible for the outreach clinic in Ireland. Dr. Claudia Zitz, who worked at the NHS's only child gender clinic for a decade, Dr. Joss Twist, who joined in 2015, are both listed as still working with the Tavistock on their LinkedIn profiles. Other clinicians at the Gender Plus include Dr. Lindsay, or Iggy Moon, who has been involved with trans activism and chairs the Memorandum of Understanding Against Conversion Therapy, which some professionals say has enforced an affirmative approach to treating people who are questioning their gender. These private clinics need investigating, and Stephanie Davis-Ari, who is the founder of the campaign group Transgender Trend, has said, "It is clearly worrying that staff from a failed service have set up a private practice. Those in private practice should be following NHS protocols in order to be safe. The Health Secretary needs to investigate these private clinics, some of which have been running for years, and to look at their standards of practice." Gender Plus says that it will take around 6 sessions, costing up to £275 an hour, and predominantly conducted over Zoom to complete a gender assessment. Once completed, a patient can also book in for a surgery referral, also costing £275. The practice says that post-assessment referral to our associated hormone clinic is available to those aged 16 years and over, and that they are expecting the clinic to be running in the autumn. The Tavistock will close in spring 2024 and be replaced by a new network of regional centres, which aim to take a more holistic or person-centred approach. Some parents have expressed concern that the closure could be seen as a marketing opportunity and may lead to a number of new private clinics opening. Previously, the main private service for under 18s in the UK was a controversial online health clinic, Gender GP, which, as we know, the controversial Susie Green, who used to work for Mermaids, now works for. NHS England has previously warned against seeking private prescriptions. In the service specification document for the new regional clinics, health officials say it is important for the GP or local health professional to explore what regulatory bodies may need to be informed if healthcare professionals registered with a UK professional body are prescribing medication contrary to NHS protocols. Marcus Evans, a consultant psychotherapist who quit the Tavistock clinic because of his concerns about the service, says that the issues raised by Dr. Hilary Cass are in keeping with questions being raised in other countries. Dr. Cass advocates for thorough holistic assessment and a cautious approach that puts quality research at the centre of medical practice, Mr. Evans told the Telegraph. This notes a shift away from an approach influenced by ideology and back to sound clinical practice by taking into account the downside of treatment and hidden long-term costs as well as short-term gain. Politicisation of this area means there has been a dearth of high-quality, long-term research on the effects of puberty blockers or cross-sex hormones. These are powerful drugs that interfere with normal biological processes, and we need to have much more information about the effect on minors' developments. He added, "The concern is that these private clinics may bypass the very serious concerns that have been raised by the Cass Review. If they are not using the same checks and balances that are being introduced in the NHS, then this is a worrying development. Medicine, by and large, works by consensus, and it is irresponsible to ignore the concerns that are being raised about hormone treatment. A spokesman for Gender Plus said, "Our staff team is multidisciplinary with medical and non-medical experts in the field of gender healthcare, mental health and neurodevelopment. We take a developmental approach to deliver an accessible, holistic and comprehensive service that goes some way towards meeting the huge level of unmet need that exists currently." I'm not sure where this huge need exists. "We are aware and up to date with the recent NHS England service specifications. Our team of experienced and specialist clinicians will continue to try and best meet the needs of this marginalised and sometimes vulnerable group." I'm going to add at the end of here a couple of clips of some of the people involved and leave it up to you to draw your own conclusions as to where you think this might end up in terms of a big money-making scheme, unless the government put their foot down.
Let's bring our attention to this weekend. We've just had Trans Pride on Saturday, a fantastic getting together of trans people advocating for trans rights under the current situation, which is proving to be quite difficult, quite challenging, particularly for young trans people. So we really do need to think about how trans people are getting together to try and work towards something that's affirmative and positive for young trans people who are being denied their trans existence. Then I look at the papers on Sunday morning and see an article that's particularly talking about gender in a gender critical way, to the point that I wrote to the editor, because the paper is misleading, it's not informing people in the correct way about the situation to do with gender, to do with transgender. And that's where we seem to have an issue. In the current climate, it isn't about gender ideology. It's about us all being able to understand the expansive way that we need to think about gender. It doesn't belong to anybody in particular. It doesn't need to be in a binary, which is inherent from history and colonialism. It's a more expansive, free-thinking idea that we need to put into our understanding of psychology, into our understanding of therapy, in order that we can explore with clients, with young people, their freedom to be able to be who they wish to be.
Thus, while it is clear that we are dealing with a highly complex problem with many causal pathways and no single causative factor, gender services tend towards a very damaging, peculiar, superficial simplification. For various reasons, not least a huge increase in caseloads, the long waiting lists, leading to pressures to process the children using a procedural model rather than one aimed at understanding the individual case in any depth. The great problem of the Tavistock service is it's a gateway, rather than being separate, it's a gateway to puberty blockers. Of course, alignment with affirmative lobbies, that is lobbies that seek to affirm the wish to change gender, tending to see it only as a positive choice to be encouraged, acts as an ideological support for this simplification. Many services lack any understanding of and are overtly hostile to any thought about the less manifest, less conscious issues in which ways that they are not for other disorders. So trans is somehow exceptionalized. Even thinking about cause is very often regarded as an act of hostility. For the only acceptable explanation is that the child is literally in the wrong body. And all suffering is secondary to this, in inverted commas, fact. It needs to be borne in mind there's absolutely no evidence at all for this assertion. It's a kind of belief, it's a kind of essentialist belief in some kind of gendered soul. Even mermaids have stopped using that term. We also need to distinguish a child's subjective account from a more external perspective. Patient involvement in decision-making is, of course, a good thing, but that needs to be distinguished from the non-questioning of the patient's account. When it becomes non-questioning, here we see a perversion of clinical care into a kind of customership, where the customer is always right. And this is perversely championed as patient engagement.
So this is quite a worrying development, and we shall be keeping an eye on how it progresses and what happens from here. Take care and speak to you soon.